Hi, so this video will be focusing on rotator cuff instability. This is when the shoulder joint is loose or unstable with the rotator cuff muscles, which include supraspinatus, teres minor, subscapularis, and infraspinatus. The main mechanism of injury for a loose shoulder joint is typically from overuse or a shoulder dislocation or stretching of the joint due to physical activity or injury or any connective tissue disorders. Typically with anterior shoulder dislocations, it will cause a tear in the rotator cuff, which then will lead to the instability around the joint. So the palpations that you want to focus on are all those rotator cuff muscles that you can palpate. You want to focus on the long head of the bicep and the supraspinatus tendon in the back, and also the acromion-clavicular joint up here. Pain will occur with the raising of the arm above the head and rotating the arm from side to side, so mainly internal and external rotation. Special tests would include the empty can test, so you'll have your athlete with their arms outstretched with their thumbs facing down, and typically you'll want to push down and have them resist the motion. So that, and then a positive test would be if their arm dropped or any pain up in the tendons. Another test would be the apprehension test, relocation, and anterior release tests, which all tests the glenohumeral stability. So you want to lay down. So for apprehension test, you'll have their arm out like this, and you will just try and put their arm back in external rotation. And if there's any apprehension with you making that motion or any facial grimacing or pain, then that's a positive test. For the relocation, you'll put pressure down on the shoulder, and again, just move external rotation. And if you can make it to the end point without any pain, then that's also positive. Whereas the relocation test is when you're in this external rotation, you'll lift your arm up, and if there's any pain or again apprehension, then it's a positive test. So back up. So common signs and symptoms are swelling, possible discoloration, clicking or pain, and also the shoulder slipping out of the joint socket and then going right back in. There's also complaining of dead arm with throwing or pain posteriorly, and possible subacromial or internal impingement signs, and as well as the positive apprehension test, relocation, and anterior release tests. So the actions we will want to focus on is first to control the discoloration, pain, and swelling with the Price technique, and also and then you'll start with range of motion exercises, again mainly focusing on internal and external rotations, which can be done with TheraBands, and then passive and active stretching. So for these, you'll want to have their arm to the side for internal and external rotation, and just move it in and out, and then have them resist against you as well. And then you can build up the resistance and with weights or with your own body. And then so as the athlete continues to come into the treatment room, we'll want to again just work up that range of motion, make sure that they're making it through all, yes, mainly focusing on internal and external, but also all the shoulder range of motions, so they can get back into their sport. And then from range of motion, we'll want to do strength around the shoulder, which can be used with the body blades or TheraBands or any throwing techniques as well. The next phase would be then sport specific. So rotator cuff injuries are mainly seen with football due to overuse with throwing. So you can do throwing a ball around while they're trying to catch all around in a circle, just to check their proprioception as well. So if the athlete is having any trouble keeping their shoulders stable, there is a training tape technique which you can tape from the shoulder blade to the arm, just to kind of help it from slipping out while they are doing these techniques. This helps keep shoulder blade and arm lined up while they're throwing or doing any of the exercises. So you'll want to avoid the shoulder from popping during these exercises and also with their home exercise routines, because as they allow it to pop or crack, then it will just make it more easily, the shoulder to slip out more easily the next time. And that is the rotator cuff instability.